This video focuses on the treatment of strokes. Because they have different causes, ischemic strokes, which occur when a blood clot blocks a vessel in the brain, and hemorrhagic strokes, which occur when a blood vessel bursts or bleeds, have different treatments. Ischemic strokes account for the majority of strokes, so I will focus more on their treatment options in this video. Treatment of stroke can be divided into acute management, or what happens in the minutes to hours after the stroke has occurred, and long-term management, or what happens months or years after the stroke. Because stroke can cause lifelong disabilities, it often requires long-term management to facilitate partial or full recovery. Acute treatment for hemorrhagic and ischemic strokes differs because they have different underlying causes. In the case of a hemorrhagic stroke, acute treatment options are more limited. They focus on controlling the cause of the bleed, most often high blood pressure, through medication and through limiting intracranial swelling. Surgery to repair the bleeding vessel is also sometimes an option. In the case of ischemic stroke, acute treatment focuses on restoring blood to the brain by breaking up the clot. This is often first done by administering thrombolytics, known as clot-busting drugs. Sometimes the clot can be mechanically removed via a catheter. When a severely narrowed artery has caused the ischemic stroke, a stent can also be placed in the artery. Long-term treatment of stroke involves rehabilitation and physical therapy. In this video, I will focus on the topics that I have circled on this flowchart. They require a more in-depth look. Fibrolytics are used only for the treatment of ischemic strokes. Giving a patient within a hemorrhagic stroke a fibrolytic drug could worsen their bleed, so correct diagnosis of this type of stroke is always crucial. Fibrolytics, also known as clot-busting drugs, are administered to try to break up the clot that is causing the ischemic stroke in the patient. They must be administered quickly after the onset of stroke, and the faster these are given, the higher the chance that brain damage will be limited. Aspirin and tissue plasminogen activator, or TPA, are the two most commonly used fibrolytics in the aftermath of stroke. Aspirin is used because it is a blood thinner that has immediate effects. If given to a patient within minutes after an ischemic stroke, it can help prevent another stroke from occurring. TPA is one of the best treatments available for ischemic strokes. However, it must be administered intravenously within 3 hours of stroke symptoms occurring. TPA can also be administered directly at the site of the clot. TPA is effective in breaking up clots and restoring blood to the brain, thereby minimizing damage. It is a naturally occurring enzyme that converts the inactive plasminogen to its active form plasmin. Plasmin dissolves blood clots. A major side effect of TPA is hemorrhaging, so it is important to be aware of the risks before administering it to a stroke patient. Another option for ischemic stroke patients that meet certain criteria is mechanical removal of the clot. Specially trained doctors thread a catheter through arteries in the body to the site of the clot. They then release a special clot retrieval device. The first FDA-approved clot retrieval device is called Mercy. The Mercy device is shaped like a corkscrew, designed to pull out the clot without collapsing the artery. Since then, other retrieval devices have been created and FDA-approved. These include the Penumbra, which uses suction to break up the clot, and the more recent Solitaire system, which is designed to act more like a net. All of these devices have been able to successfully recanalize arteries after an ischemic stroke. Recanalization refers to the process of restoring blood flow after it has been interrupted. If the ischemic stroke occurred due to stenosis or narrowing of an artery, then a stent can be inserted into the artery to widen it. The technique of mechanically widening a narrowed or obstructed artery is known as angioplasty. A guide wire with an empty and collapsed balloon is inserted into the artery. The balloon is then inflated to widen the artery. If the artery needs additional support after being widened, a stent, which is a wire mesh tube, is inserted. The stent holds open the weakened artery. Now let's shift gears to surgery for hemorrhagic strokes. Some patients who suffer hemorrhagic strokes are candidates for surgery to repair the site of bleeding. If the patient had an aneurysm, a weakened bulge in the artery, a surgeon can place a clip at the base of the aneurysm. This can prevent rebleeding if the aneurysm has already hemorrhaged. Another technique called coiling can also be used for aneurysms and is less invasive than clipping. This technique is more often used for unruptured cerebral aneurysms, but can occasionally be used for ones that have burst. A catheter is threaded to the site of the aneurysm. A coil is then released into the bulge and left there permanently to seal it off. With both hemorrhagic and ischemic strokes, a major concern is often swelling in the brain. The body's response to injury is often swelling or fluid accumulation in the tissues. This is also known as edema. Cerebral edema from stroke can be life-threatening. When the brain swells, it has nowhere to go because it is encased in a very inflexible skull. The brain becomes compressed, causing blood vessels to be squeezed and severely impairing brain function. Surgery to relieve intracranial pressure can therefore be required in the case of a stroke. After a stroke, some type of rehabilitation is often necessary. Long-term treatment and care for stroke patients revolves around recovering as much brain function as possible and regaining as much independence as possible. Many stroke patients have suffered irreparable brain damage, so they need help adapting to a new way of life with a permanent disability. The impact of a patient's stroke depends on the location and severity of brain damage. For example, if a person suffered a stroke in an area in the occipital cortex of the brain, which processes visual information, he or she may have a loss of or blurred vision. If the patient has brain damage in the left motor cortex of their brain, they often have paralysis in their right arm, right side of their face, and/or right leg. The majority of neuronal patterns in the brain are contralateral, meaning the left part of the brain controls the right part of the body, and vice versa. Because patients recovering from stroke often have different disabilities, rehabilitation should be tailored to the patient's specific needs. These can include speech therapy, physical therapy, occupational therapy, and psychiatric assistance. That's all for this video. Thank you for listening, and check out my previous videos on stroke.